Good morning. My name is Dr. Queen Mwakwawa. I'm a medical doctor from Malawi. I will just give an update on the situation of diabetes and nutrition in Malawi as of now. So as we all know, NCDs have been on the rise worldwide, and Malawi as a country is not an exceptional. We have seen a transition from infectious diseases to now NCDs, including diabetes and hypertension. In Malawi, we had a population-based nationwide cross-sectional survey in 2017, which showed that the prevalence of diabetes was at 5.6%, which was quite high. And in this study, 96% of individuals actually reported to never, ever have ever been measured for a blood glucose test, which is quite worrying. And 21.5% of individuals were overweight. Most of them were women, and there were more overweight individuals in urban settings as compared to rural settings. And there was also a question on the salt intake, and 17.4% of individuals mentioned that they add salt always or whenever they're eating, which is quite high as compared to the recommended WHO salt intake limit of 5 grams of salt per day. So as a country, there have been some initiatives done countrywide as regards to diabetes. So the Minister of Health introduced NCD clinics in all the 28 districts in Malawi, and this was 7 years ago. And so all patients that have been diagnosed as being diabetes from any point of care at the hospital level, they get referred to these NCD clinics where they are managed. And also the health workers that work in these NCD clinics get clinical mentorship, and the clinics also get some medical supplies, including glucose sticks and some drugs. And currently, there's an initiative to distribute hemoglobin A1C machines. They have actually started being distributed to at least 10 districts as of now, and it's expected that it will be scaled up to all the NCD clinics at district level. So that's at a hospital setting, but there are also initiatives at community level. What we have seen is also a transition in terms of changing behavior. More people are now being more aware about their health in terms of diet and everything. So we are seeing more of people walking, jogging in the mornings, in the evening, people signing up in gyms, which is quite a good transition, especially in urban settings. But also there have been initiatives at government level with its partners. For example, currently the government with its partners have procured blood pressure machines as well as glucometers, which are given to community health assistants who take care of a community. So these community health assistants, they are able to screen individuals for diabetes and refer clients with high blood sugar to hospitals for further diagnosis as well as management. But also, apart from that, there's also a lot of community awareness, sensitization campaigns driven by the government as well as its partners, so that there's a demand for diabetes screening as well as management. So how does a typical diabetic patient look like in Malawi? So from the start, before people are diagnosed with diabetes, what has been noted is that people have bad health-seeking behaviors. So they report late for diagnosis. As mentioned in the earlier slides, 96% of people that had been tested for sugar, they had never had a blood sugar test before. So there's late diagnosis. People present to the hospitals with only complications. And of worrying is that there isn't a consistent drug supply of blood sugar commodities like drugs, glucose sticks. And this also has some effect in terms of blood sugar control for the clients if they don't have enough drugs. And also what was worrying in one study that was done is that the health workers that actually give advice in terms of what food to eat to clients who have diabetes, they are not giving the right counseling. So they tend to prescribe meals that have a lot of calories, which actually might worsen the diabetes condition. But also there was a study that showed that the adherence was not very well because maybe of pill burden. Most people who are diabetic, they also have other comorbidities, for example, high blood pressure or maybe HIV. So that pill burden disrupts their adherence to drugs. But also for people, because you know of the diet restrictions that come with being diabetic, patients, it's not easy for them to accept the diet change as well as lifestyle modification. For example, one study that was done, one female participant, and I called, actually said that it's not just easy just to stop eating the foods that you are used to eating abruptly. You just wake up one day, you go to the hospital, they test you, and on the same day they tell you to stop eating this and that. It's impossible. Let's not cheat ourselves that it's possible either way to change our lifestyle. So that was a patient, but now how does a clinic look like? A study which was done showed that most patients that go to these clinics, they don't have enough information about the condition of diabetes, which is worrying. But also the patients were not satisfied with the services that were provided at the clinics. And not all nurses or clinicians that were working in these clinics were well trained in diabetes, and guidelines on diabetes management were not accessible. As earlier mentioned, there was obvious a shortage of medicines as well as reagents, but information education and communication messages were offered through discussions and experiences. So this was a study that was done in 2014 at one of the district hospitals at the diabetic clinic. So what's the way forward? We definitely need more community sensitization so that people, more people can know about their disease condition, especially diabetes. And then if they have it, then they can be easily managed. There's definitely a need for increased services among the poor, that is, bring the diagnosis to the poor so that they can afford and then they can be diagnosed. There's also a need to intensify diabetes screening at first level hospital. So this is at hospital level. So at points of care, whenever clinicians or nurses are seeing patients, there should be an initiative to screen patients for diabetes. And also there's need to improve accessibility of diabetes treatment. So we need more funding in terms of drug supply for diabetic drugs in all our hospitals as well as our clinics. So I think that's the way forward from our point of view from Malawi. And these are my references. Thank you very much for listening.